So I want to talk about something I feel like is so vital. I've been talking about it for years, but now due to the time of the year and because of the landscape of everything related to health and wellness today, I think it's so important. The spoiler alert is I'm talking about vitamin D. And the truth is, people feel really out of control. I feel like there's a lot of fear, uncertainty. This is not about whether you're vaxxed or not vaxxed. And it's not just about COVID. We're heading into cold and flu season and the bronchitis and strep and all of that other kind of stuff. But the real truth is that you have control over your health. And the number one thing you can do to boost your immune response, honestly, is to not just take D, but make sure that your levels are not just sufficient, but that they're at optimal. And there's some really great new research that's out. So even though I've been talking about this for years, I wanted to share some of that. I just have all these notes in front of me, so this is not scripted. But four things I just want to share. Number one, a little bit about the studies. Two, what deficiency, sufficiency, whatever that looks like, why this works so well, and really how you can know where your levels are, get to the levels that you're supposed to be and all that. So really quickly, and I'm going to try to keep this somewhat short, so I'm just going to kind of encapsulate everything. But recently I was turned on to a letter that was really a press release that was signed by over 200 scientists and doctors that were basically calling for governments and healthcare workers and doctors to really just call for an immediate widespread increased vitamin D intake, education and push. And the reason for that is because there have been over 70 specific studies related to COVID-19 and the outcomes when your vitamin D levels are actually appropriate. I have one study here that is just showing how over 80% of COVID patients have a vitamin D deficiency. And I'll talk about what that means in a little bit, but that right there should really give you a really good insight, because irregardless of your vaccination status, that was the number one determinant. Didn't matter if you had received treatments or not, it doubled your survival risk. Now, let's be clear, survival rates are still extremely high for COVID, but if there's a fear factor in you, it's how severe would I be if I did get it? Or would I be that 1% of people who did end up, in the hospital or worse, or have a worse fate or after effects or what have you? So again, the number one thing you can do is take some charge of your own health. And it's really simple to do, but I just want to read you a little bit of this letter, just a little bit of it. Okay. So research shows low vitamin D levels certainly promote COVID-19 infections, hospitalizations, and death. And given its safety, they were calling for immediate widespread increase in vitamin D intakes. Vitamin D modulates thousands of genes and many aspects of immune function, both innate and adaptive. And the scientific evidence from many of these studies show a couple things. Higher vitamin D blood levels are associated with lower rates of SARS-CoV-2 infection, so less infection rates overall. Higher levels are associated with lower risk of a severe case, so that's hospitalization, ICU, intake, or death. Intervention studies indicated that vitamin D is an effective treatment for COVID-19. Many of the papers revealed several biological mechanisms by which vitamin D influences COVID-19. And then that there was a causal effect. Vitamin D's influence on COVID-19 is causal, not just a correlation. So that's huge for all of these articles and these studies to be able to sort of determine that. And the thing is, though, is most people are deficient or they're insufficient. So I want to talk to you a little bit about that, what that looks like. First of all, you may recognize that you're a little deficient, but not know you are because of certain symptoms that you could have. So you might be somebody who gets sick often, or you don't recover quickly if you get some kind of an infection, or you feel like you're repetitively getting sick. You could be fatigued, tired, you get your bones hurt or muscles hurt, hair loss, muscle pain, depression, those types of things. I've seen a lot of people just with really low vitamin D levels who were fatigued and felt very depressed, and then their D levels came up and they were feeling so much better just from that. But if you have low vitamin D levels, you are at an increased risk for many different kinds of cancers, respiratory distress, cognitive decline, asthma, obesity, cardiovascular disease, the list kind of goes on, and autoimmune issues, cold, flu, respiratory illness, that type of thing. So, and that's in addition to like osteoporosis and the things that we already know. So if you were to get a test, and your doctor can do this, or I can give you a link for, a $30-ish test that you can have your D levels taken. But either way, there are sort of a few numbers to think about. One of them is 20 and under. If your number is 20 and under, when your vitamin D level comes back, that would be considered deficient. Okay. There's a very large population, over 55% of the population worldwide is in that deficient category, but they feel like there's people between the 20 and the 30, and 97.5% of people, just to reach that 20 nanograms of per milliliter of the vitamin D, would need probably 4,000 to 6,000 IUs of D on a daily basis. Okay, I'll come back to that in a second. But so then you have 30. If you're somewhere between 20 and 30, you're considered to be insufficient. So that's why normally if you go to the doctor and you get it tested and they see if you're 30 or above, they'll say you're fine. So, but 30 is the barrier from being insufficient. So even though at 30 your number is okay, doesn't mean that it's optimal. And there's a correlation. The higher your levels of D to a point, there is an inverse correlation to how sick you might get with COVID, as an example. So a lot of doctors say that somewhere between 55 and 85 is sort of that sweet spot, where if your levels are there, that's really the best immune response and protection that you can get from the vitamin D. So for you to have your levels taken, it's so important to stay up on that. But we'll talk about dosing and stuff like that in just a second. So the key thing is to know is that vitamin D has a lot of anti-inflammatory effects. It helps your body to create antibodies in general. It has a huge immune response because basically it's, regulating a lot of the expression of a lot of genes. I think over 2,000 genes or so. Many of them are associated with the immune system. Vitamin D has been shown to be 6 to 10 times more effective than a flu shot and boosts your immune system by about 2 to 3 times what it is right now. And it has anti-inflammatory properties too. So you could kind of see why with any kind of respiratory distress, flu, virus of any sort, how it might be really important. But here's the other thing to keep in mind. There is a receptor on every single one of your cells for vitamin D. Vitamin D receptor on every single one of your cells. Technically, it's a hormone, not even a vitamin, but in the vitamin category, it would be considered a fat soluble vitamin, which also means that you could take it sort of every other day, but you can play around with the dosing in that way. But I just thought it was so important that these 70 published studies had come out, and all of them really pointing to the same thing about the effects positively on outcomes of COVID specifically. So anyway, so let's just talk about some other things here. I told you that under 20, you're deficient, under 30, you're insufficient, 55 to 85 is probably that sweet spot or whatever. But then how do you know how much to take? Well, the first thing you can do is you can get tested and you can get retested. So you could get tested, you could get tested a month later or 2 months later, or what have you, to kind of see where your levels are at. But they say that for most people, the recommendation, so like the standard dosing is like 2,000 IUs a day. But again, remember, just like with vitamin C, the amount that's recommended on a daily is enough to prevent scurvy. It's not enough for optimal health, even though we know vitamin C is so good for so many other things at higher levels, right? So it's the same thing with D. So according to all of these studies, it was shown that 4,000 IUs daily of vitamin D was likely the best recommendation. But if your levels were lower or you haven't been taking vitamin D, it was recommended that you could go 10,000 IUs for at least 2 to 3 weeks to sort of catch up on that, and then like have your levels tested and see where you are from there. It also said that if you have either higher risk factors, which is SODA, S-O-D-A, so if you're a senior, if you have diabetes, if you're overweight, or if you're African American or dark skinned, that you might likely need like 8,000 IUs daily. But either way, it's very difficult to be taking so much, that it would be toxic. Even though it is fat soluble, it'd be very difficult and very rare for you to be taking too much. And especially because you can have your levels taken, you don't have to really take a guess in the dark. One thing that I found really interesting, though, in one of the studies that was done at a nursing home, was that, again, it was like irregardless of vax status in both categories or unvaxxed in both categories, irregardless of whether they had COVID and they got different kinds of treatments, from antivirals to hydrochloroquine to whatever they were doing, vitamin D was the #1 factor that increased their survival rate 2 times. And you know that that's a very frail population, right? So it was like 44% in the non-D category of not taking it, and it was 82% in the category that had taken vitamin D. How much? They gave them a bolus, 80,000 IUs, either the week that they were diagnosed with COVID or the month before. And those were the people that were in the better survival rate and less severe risk with the vitamin D, which I thought was like huge in that study. I thought that that was really remarkable. So anyway, so how much do you take? Our family, we take 5,000 IUs. Normally we take higher amounts. If I feel like somebody's getting sick, if they're getting a cold, we might just do 3 days where we really just kind of double to triple that, where we do somewhere anywhere between like 10 and 20,000 IUs for a few days to kind of kick it. If it was for my parent who is, you know, older, I would have them take like that bolus of 80,000 IUs, even though they might've been taking 4,000 to 5,000 on a regular basis. So that's just really what we do. And I have my favorites for like which kinds of vitamin D. There's a few different manufacturers that I like to work with, and I will definitely put that link on my website so you can check that out there at www.aprilrashat.com. But I think that the takeaway here is that, you know, do your research. I think that you're going to find it's, you know, especially nowadays when you see that a lot of stuff is getting censored, it's not hard to find the information that's out there on vitamin D. And yet I still feel like I talked to a few clients lately and I asked them what their vitamin D levels, and they still had no idea. I had my father just was at a general practitioner's office, and he's just had a surgery, and they still didn't check him for vitamin D. So sometimes you have to be your own best advocate, and you just have to ask, but it's very rare that they're not going to have you take it, because the information, the science is there, that you just want to check where your levels are to be able to see what the appropriate amount of dosing would be and where you're at, and just be able to track that for just, you know, generalized immune support. So the takeaway is that you do have full control, and you can control what you put in your mouth. You can eat more vegetables, you can get better sleep, you can hydrate, you can exercise, you can meditate, you can try to stay positive, stay around your friends. But there's certain things with, you know, supplementation that you can add to that really will make quite a big difference. So I hope you guys all take that to heart. And if you need more information, go ahead and check out my blog or my website.